Good afternoon. I am your host this afternoon, Yvonne Lewis, and I want to welcome you to the Healthy Flint Research Coordinating Center community webinar on coronavirus. This is July 17th, and we are certainly appreciative of each one of you that have taken your time this afternoon to join us as we are diligently preparing to provide you with information that's relevant to our community. We've also become aware that others outside of our community are also finding this beneficial. So we give a base of information that we hope can be helpful to everyone that listens to our webinar, but we also want to make sure that we provide a community context. For those of you that are joining us for the first time, the Healthy Flint Research Coordinating Center is a collaborative partnership, multi-institutional, working with community partners, University of Michigan Flint, University of Michigan Ann Arbor, and Michigan State University to provide the best information that we can to assist in understanding some of the issues that are happening in our community. We are streaming live, so we also want to welcome those of you that are listening via YouTube. For those who have joined us by YouTube, you may not be able to see all of the information or even by phone that's shared on the screen. So I do want you to know that you can go to the website info@hfrcc.org to learn more, to send in questions, or you can call 810-835-2130. If you are in the webinar, we want to remind you that you could go to the Q&A button on your screen and put in questions that the panelists may be able to answer for you. We want to appreciate, for the last 18 weeks, we have had panelists come on every week to respond to questions that have been proposed by our community members. For those of you who cannot see on the screen, and for those of you that are, we have some new panelists along with us, in addition to our regular panelists, who are Dr. Deborah Furholder, Susan Kupel, Dr. Lawrence Reynolds, Gary Jones, Dr. Susan Wolford, Kirk Smith, Afton Shavers, Nicole Anderson, Dr. Rick Sattler. Dr. Tupper is back with us again, and I want you to know he is in full gear working at Hurley Medical Center, but ready to answer questions. In addition, we have representatives from Blue Conduit, Ian Robinson, and Jared Webb, who is also from the University of Michigan, Sarah Tallman, and Stacy Woods. They're going to share some really important information with you today. I think it's really critical to understand we are in the midst of a pandemic that is COVID-19, but we have not forgotten for Flint that we have also been in the water crisis. It is not ended yet, and we have had many questions that have correlated the COVID-19 and the water. You've heard us talk about so many times, and Dr. Reynolds is here with us today from the city of Flint. And you've heard Dr. Reynolds say many times about water restoration and the things that the city is doing to ensure that no one in our community is without access to water. And that this is very important for our conversation today because of the presentation we'll have with our newest panelists today, Blue Conduit, and the national group. I almost forgot their name. So we really want you, NRDC, National Resource Defense Council. So we really want to be sure that we're responding to your questions. So continue to keep those questions in. So Dr. Reynolds, we want to welcome you here with us today and ask you to give us your important insights and updates and help prepare us for the conversation about the pipe replacement program and the map that has been designed to give our community members more insights. Dr. Reynolds.
Yes, I'll do a couple of quick announcements. Number one, there is testing going on right now at Word of Life Christian Center on Atherton and 475 in Flint between 9 and 1. And if you don't make it today, it's also tomorrow, same site between 9 and 1. All you have to do is drive up and show up. And I'm speaking to you mainly because the mayor's chief of staff is there making sure things go smoothly. I would also like to let folks know that masks are available. You can apply online at the City of Flint website or dial 410-2020. The masks are for faith-based communities and small businesses. So you will get a response by email if you apply online and don't call. The water that never ends. We are collecting tier one samples. Residents may call 410-2020 and volunteer to collect samples for water testing for lead, copper, and all they have to do is call. You may also find health navigators from the city knocking on your door asking you to participate, and they'll be carrying jugs. And if you participate, we greatly appreciate it. We did reach our goal for the last testing period, but this is an ongoing process. They
Dr.
will,
Reynolds, excuse me for
yes.
interrupting you, but can you explain tier one sampling for us, please?
Oh, yes, and that's directly pertinent to the next topic. That's testing residences that are primarily considered to have lead service lines. So it requires a lot of searching as we replace lead service lines to make that determination. But that would be tier one testing. And you will get 5 bottles that you must collect as soon as you turn on your water in the morning. And if you volunteer, you will get more specific instructions, and then you call and it will be picked up. So this helps us determine water quality for homes, and it helps us get a seal of approval from EGLE, which is the Environmental and Great Lakes uh, Division of State Government. So we want to make sure that the city of Flint remains in compliance, and we really depend on your assistance. If you recall, last month it was the firemen going around door to door with us. So that should give you an idea of how seriously we take this testing and being sure that homes do not have elevated lead levels. And I should also say, if you want to have your water tested just because, that's sufficient reason. All you have to do is call 410-2020 and someone will be sent to your home with a test kit. Did I answer your question?
Yes, sir. Thank you.
All right. So let's talk about lead service line replacements. These were installed years ago, and the city has never had good records. So we have uh, we have pledged to replacing lead service lines, just like the city of Lansing has done over a 10-year period. We are now on year 5 and trying to get this completed. That means replacing the connections from the water main in the street to your water service, your water meter at the house. Sometimes it's all lead, sometimes it's part lead, but that is one source of lead that leaches into your water. We can talk about fixtures at another time, but the key is if you have any question, just call and ask for a test kit. Okay? So there have been 25,646 service lines dug up. Okay. There have been 9,603 service lines that required replacement. We are not done yet. So if someone has asked you as a resident, do you want your lead service line replaced? And you may have said no in the past, you can say yes for now. And if you changed your mind, please call 410-2020. We have a ways to go to get finished. And the goal is that we get done by the winter. But in order to do that, we need your cooperation. And yes, it is a headache because they do dig up your lawn. They may dig up the curb in front of your house. They may have to go through your sidewalk. I've been through it, and I must admit it looked like there were bodies buried on my lawn for a while. But they do make an attempt to restore. But let's look at the big picture. Lead poisoning in your water is a permanent, lifelong health risk or damage. So we need you to say yes so we can get this done for the safety of the residents of Flint. So that's 25,600, almost 2,600 sites have been excavated. 9,600 have been replaced with non-leaded service lines, and the work continues. Now, you may have said, well, why is it taking me so long? There have been some situations like on DuPont on the north end where the whole street had to be dug up and the crews were shifted over there to make the replacements of lead service lines along DuPont since it was open so that the repair work that was done would not have to be torn up again and repeat the process. So those things will happen occasionally, but the program is on task and we need your cooperation, and please work with us. Now, how do we know who doesn't have a lead service line and who does at this point? And we needed help because if you recall, these things were recorded on note cards. They were chewed up. They were watered on. They were illegible, and so Blue Conduit, as a result of a settlement with the National Resource Defense Council, have provided assistance. And I will turn it over to our guests at this point.
Thank you, Dr. Reynolds. We appreciate that segue. And as you can see, for those of you that can see on the webinar, we have with us today Ian Robinson, who's the managing director of Blue Conduit, and he'll explain to us what Blue Conduit is all about. We also have with us Jared Webb, who's the chief data scientist of Blue Conduit. He's also a researcher at the University of Michigan Flint, so that you hear that researcher in the Healthy Flint Research Coordinating Center, right? And Stacy Wood, who is the geostatistician for the National Resources Defense Council. And so, Stacy, we want to welcome you all here today. And we're going to just shift a little bit in this next few moments, and they're going to share with us some very important information about Blue Conduit and this whole map process that they put in place to assist us here in Flint, understanding where the lead service lines might be and how this will be beneficial to us as a community. So Stacy, welcome.
Great, thank you so much, Yvonne. I'm going to ask Ian to take over while I share the screen here.
Great, thank you so much, Stacy. And thank you so much to the Healthy Flint Research community for having us today to, so that we can present the new Flint service line map, which aims to empower residents with information about the status of the pipe replacement project at their address, what they can do to get their pipe either inspected or replaced, and then steps that they can take to reduce their lead exposure. So we are the team behind the map that you guys see on the screen, the Flint service line map. So I am Ian Robinson from Blue Conduit, along with my colleague Jared Webb. Blue Conduit is a data science consultancy passionate about improving public health. Our team so far has been focused on locating lead service lines, starting in Flint in 2016, and is now helping more than 20 other cities do the same. We're joined with Dr. Stacy Woods, who works as a scientist at the Natural Resources Defense Council, or NRDC, which has been working in Flint for years. So we created this map because we believe that Flint residents should be able to easily access information about the water service lines that bring the water into their homes. The city of Flint has said that it wants to finish the pipe replacement work this year, which means the clock is ticking for everyone who wants to get their service line checked and replaced under the pipe replacement program. If you have specific questions about the pipe replacements, please direct those to the city. Today, our presentation is about the map that we built that shows the pipe materials at each home. So as I mentioned, why would we create this map? As I had mentioned before, we created this map because we believe that residents should be able to access information about the water service lines coming into their homes. We have been working on this map for almost a year and wanted to get it out now. Since the since the city has restarted its inspections and replacements after hiatus due to COVID. The city is committed to inspect residential service line addresses with active water accounts and to replace the lead and galvanized steel lines that at no cost to the residents. But residents must give the city permission to inspect their service lines. And this is the kind of information we include on the map. Flint residents can use the website to find out the current pipe materials and to find out whether and when their home lines have been inspected, and links to the city's website to give inspection permission forms and to access resources on how to protect your family and friends if they do have lead service lines. I'm going to pass it over to Jared right now, who's going to talk about the data that goes into the map.
Yeah, thanks, Ian. So when we began to work with the city in 2016, the city data on pipe materials was not easily available to residents or to researchers for that matter. In fact, the only information we were able to find was contained in tattered hand-drawn maps that you see on the slide here. This new map makes all of the city's service line data available to any resident at any time. So how it works is we periodically receive data from the city where they have visually inspected or replaced a service line. Once we get that data, we push it up to this map so that it is up to date as soon as possible. So the most recent update to the map was just last week. For houses where the city has not yet inspected, we assign a likelihood of having a lead service line based on a mathematical model. This model uses publicly available information like the age of a house, its location in Flint, and existing service line records as inputs. So we've been asked about how accurate this model is. The short answer is that we've found it to be very accurate. For example, when we are given a home with a copper pipe and a home with a lead pipe, the model correctly predicts which one is which 95% of the time. You'll see on the map, and you can see it even on the screenshot here, that there are some homes that are yellow. This means that those homes have a moderate likelihood of having a lead service line. There's various reasons this could be. It might be because information we have from the city isn't indicating that there's safe pipe material at the location. Sometimes the data we get is just plain messy. For example, there are homes where the city records say the pipes are galvanized or other material. And then there are other homes that say plastic or other material. Some homes are just labeled other material. So in the face of this uncertainty, when there's not much clarity, and we get these mixed signals, we try to we've tried to train the model to be very precautious. We never want to say that a home doesn't have lead. So that said, I'm going to turn the time over to Stacy now, and she's going to walk us through the map and give a little demo.
Great. Thank you very much, Jared. So I'm going to move over here, and hopefully you all are seeing the map live on your screen. And the people on the video give me a thumbs up. All right, excellent. Wonderful. So this is what you see when you enter the map website, and you'll see the current service line information across the city. And it's color-coded, and those colors are explained over here in the legend on the left. So you'll see different colors for the known and copper and the known lead. Those are for houses where the city has already gone and inspected the pipe materials and reported to us, the map makers, what they found there. And then for the houses that haven't yet been inspected, that's when we use that model that Jared was talking about to assess the likelihood of lead being at those houses. So there are quite a few residences here that you'll see are colored in gray. And you'll note over here in the legend that grayed out properties are just residences where we were unable to verify water accounts. So that could be for any number of reasons. So for example, some of these plots are empty homes without active water accounts. Some are just vacant lots with no homes. So when you look here at the map, you can navigate around any number of ways. We have a zoom function in the lower right-hand corner, so you can zoom in and find your home that way. But you can also search directly for your house. So I have a volunteered address, and I'm just going to type that in here. So you can see I don't even have to finish typing, it pops up. and the map will just zoom directly to the address I'm looking for. So when it zooms to your address, or if you navigate to your address using those buttons and you click on your house, you'll see some information here in the pop-up. And the top line information gives you what your current home water pipe material is made of. Now, for a home like this, where it's already been inspected and the pipe has been replaced, we also list the date of that replacement. And for homes that we have the historical data, we also provide that information for every home on the home's pop-up as well. And within these pop-ups, there'll be additional information depending on the home. So for example, this pop-up brings you to a description of what is meant by public and the private side. Because if you'll recall for that home, it said the old water line was lead on the public side and copper on the private side. And that gets to something that Dr. Reynolds talked about how there's the two different sides of a water service line, and those sides can be made of different materials. So that had kicked us over to a specific frequently asked question, but from the MAP website, you can also get to an area of frequently asked questions and answers. That's up here on the top, frequently asked questions, FAQ. So these are questions that we heard a lot from people as we were developing the map. We worked a lot with community members. We had some great volunteers just from the beginning, from the get-go. And so every time we heard the same questions repeated time and time again, we added them here to the frequently asked questions section. So if you're thinking of a question, they may already have been asked and answered, so I want to make sure to point this out. And we don't have time to go through all of them, but I do want to point out a few that I think we hear more often. So the first one is this, and understandably, it's probably the thing we hear the most. When can I expect my home water service line to be replaced? So the City of Flint, in giving us the data, doesn't give us estimated replacement dates. But like Dr. Reynolds said, the city does intend to visit all remaining homes this year. So we link here and throughout the map to the city's Flint Pipe Replacement Program website, where you can get information from the city about the pipe replacement program. We also have a phone number here. And as Ian and Dr. Reynolds discussed, you do need to give the city permission to inspect your home pipes. So we wanted to make sure that we are linking you all to the opt-in permission form that's over here in this link. And also there is a website where you can check and see if you have already given that permission. So all of that information is here in the frequently asked questions section under when can I expect my home's water service line to be replaced. So another question that we get a lot is, well, if the city hasn't already looked at my pipes, how can the map decide if it's likely to be made of lead or copper? So that gets to that mathematical model that Jared was talking about, and we explain it a little bit here in the frequently asked questions as well. Just this idea that we use information that we do have, which is things like the age of the home, to predict information that we don't have for certain homes, which is namely whether or not there's lead pipes. So I just want to point out here that there's some more information, including explaining what is a mathematical model and some links out to recent publications specifically on this mathematical model. And then finally, before I navigate out of the frequently asked questions section, I want to return, again, we get a lot of questions about why is there so much gray on the map? And why can't you verify that home service, home water service? So just again, to revisit that, if a plot is gray, if there's a gray box on the map, that simply means that we, the map makers, were unable to verify a water account. But if you find that a home of interest is gray, you can still reach out to the City of Flint. So we again include that information to the Flint Service Pipe Replacement Program. So from any section inside the map website, you can return back to the map itself, either along the top banner or by clicking the map symbol. And I just want to point out a few elements of the map page itself. So one of the things that we talked about when we were putting this map together is that we really wanted to make sure that it was as usable and as accessible to as many people as possible. So to that end, we did things like we created a colorblind friendly version of the map. So if you're in the map and you're over here on the left side to the legend, if you scroll down and you click this colorblind friendly box, it changes the map colors to use a palette that's more visible across different visual abilities. So that's just one other way to view the map. We also wanted to make sure that we provided this information in Spanish because Spanish is the second most frequently spoken language in Flint. So there's many ways that you can translate the map website into Spanish. From within the map, you can click on this and it changes the entire website from top to bottom into Spanish, including the pop-up boxes. It also changes the frequently asked questions into Spanish. And if you go to the home page, so if you start with flintpipemap.org and you want to see the Spanish version, you can click this and the entire website also is translated into Spanish. I'm going to put it back into English because my English is slightly better than my Spanish. So before I open this up to your questions, I just want to make sure that I'm pointing out a few of the ways in which Flint residents can contact us, the map building team. So first of all, if you see something for your home that isn't correct and you would like to submit a correction, on the left-hand side here in the legend, there is an option for clicking here to submit a correction via a form. We recently also added this user experience survey link on the top. So from the map page, if you look at the very top, you can click on the user experience survey and it takes you to a very short, only 8-question survey that's there. It's designed so that we can get a sense of how the actual users are experiencing the map. So again, we've really worked with so many community members and so many amazing volunteers who have helped us build the map in the website so that it actually shows the things that people want to see in the way that it works for them. But we're just constantly interested in updating it, making it better. And you can help us by providing that feedback through that survey. And finally, I want to show that we have a contact form here as well. So again, from the top line banner, you can click contact, and that will bring you to a contact form where you can reach out to us, the map making team, directly. I just want to note that the contact form will ask for your name and your email, but the survey form is anonymous. So just to let you know that there are ways to reach us anonymously if you would like. So with that, I just want to thank you all for letting us present today, and especially a huge thank you to Yvonne, not just for inviting us to present here today, but also for providing your input when we were building the map. That was really great, and we're going to open this up to questions. Thank you.
Thank you, Stacy and team, Ian and Jared. And I want to engage Dr. Reynolds in this conversation this next couple of minutes. We do have a question in the queue. I think it's important for everybody. There's a number given on the information for the service line replacement program, which is 810-410-1133. The question says this number leads to Rove Professional Services, who claims that this is not the right number to call. Now, depending on who answers the phone, they are really nice and give you another number, but sometimes they just deny knowing what you're talking about. So the question is, why is the number still being given out if it does not connect directly to the city's program?
Well, that's exactly why we are soliciting feedback. We had not ever heard that that was a problem. So this is a number that I had called and verified like a long time ago. As somebody pointed out, we've been working on this map website for over a year. So perhaps this is an old number, but Dr. Reynolds, maybe we could work with you to get this number updated.
Yes, and City Hall has been closed since March, and there have been people out, and that's why I always recommend, if you have a question about water, you call 810-410-2020, because there is always someone on staff there that can give you an updated number. Keep in mind, when a city administration changes, faces and places and phone numbers change. This having to close down City Hall has set us back as we make all these transitions. So 410-2020, they should be equipped to connect you with the right source.
Thank you, Dr. Reynolds. And I do want to say to this team, certainly with respect to how we do our work with the Healthy Flint Research Coordinating Center, which is working to coordinate a lot of this research that's going on, though we can't get our hands around all of it. We're really working, but I can say that this group has really worked hard to hear the voices. And as you can see the map and all the work that they've done, I was one of those skeptical community members. I had tons of questions, but they did not hesitate to answer those questions and then to ask for identification of others who would do so. And this represents the voices of community. So I hope all of us who are on today recognize the importance of our voices and that your voice really does count and make a difference. So are there any other comments that you'd like to make to our listeners today? Stacy, Ian, Jared. You're all on mute, smiling beautifully, but you're on mute. Okay, Stacy.
Well, again, like I said, I really appreciate somebody flagging this in the comments, and like Yvonne said, I mean, this is something like this map can't get better without input like that. So please let us know. We will update this phone number right now, and we're just really excited for this map to be live and to continue this conversation with everyone.
Okay. All right. So I'm sure you're going to hear from some others who have some insights for you once this is put up. I think Dr. Reynolds, you said something before, and I think you talked about the testing, that we can't get tested one time and it's a one and done. But I think that your comment is relevant to other things too. This is not a one and done. So again, we're encouraging any of you who see some issues with how the map presents for you, please contact this group. Would you like to give them a specific number, or would you like them just to go back to the website and put in for questions there?
Ian, I'll let you take this. Yeah, Ian, why don't you take that?
I think the easiest way is just to click the contact form that is on the website, and that email goes to me, Jared, and Stacy directly. And so we will take care of those as soon as we get those, and then help make any of the changes that we need to make to the map to make it as helpful and useful as possible.
Thank you. Dr. Reynolds, I don't know if you can see the questions in the queue, but we appreciate the listeners here. They just called 410-2020, and they were told this is not the number either. So we're gonna throw that back and say to our listeners, we're gonna let Dr. Reynolds work on that and come back to us next week with some clarity. And again, this is why your input is so valuable, because we can work on it even as we speak. Dr. Reynolds, while we're transitioning to our next, and thank you again, team, for coming on. We'll look forward to having you come back and be with us in future webinars. I would like for Dr. Reynolds, if he could spend a little bit of time, because as they talked about the pipe replacement program, it is also important for us to remember the flushing protocol. So Dr. Reynolds, can you talk to us a little bit about that? Because I did some reading the other day from a document I received from the water department some time ago, mentioning that the lead lines may be replaced outside of my home, but there may be some things inside my home that I still need to give attention to. And so understanding that flushing protocol is extremely important. So please give us a reminder on that.
Oh, yes. There's the lead service line outside your home, but there's also the pipes inside your home, and there are also the fixtures inside your home. If you have old plumbing fixtures, that means spigots and faucets in your house, they may be leaded. That's another reason why we recommend people do not drink from their outside hoses, because those fixtures may be leaded. And that means they have to be replaced. Now, just by regulation, what was called lead-free in the early 2000s was in fact not lead-free. So we have the same problem in the schools, but you may need to have those fixtures replaced. Now, back in 2017, when my lead service line was replaced, I also was able to get my faucet in my kitchen replaced because that was the main source of where I got my drinking and cooking water. So this is important, and this is why it's important for you to test your water, because those lines may be replaced, but those fixtures may still be leaking lead, and you need to test your water. First thing in the morning, you get a sample. You can get the sample kit from the city, and you test your water. Okay. Then there's the other issue of flushing your line. Just because you had that lead service line replaced with another metal like copper, you still have a problem. And that problem is you have to flush all the lead out of your system, your water system, because there are flakes, particulate matter, and there's lead that must be flushed out. So the recommendation is to flush your lines first with cold water for 30 minutes. And that sounds like a lot, but how much is your brain, heart, and kidneys worth? You need to flush your system. Consider it like you're watering the lawn. You don't use the water, but your lawn gets the water. Okay, so you must flush your lines. Now, I am a Flint resident. I have had my lead service line replaced. I still choose to use filters, but I still flush my lines for 4 minutes, especially in the kitchen, for 4 minutes before I use it for making coffee, drinking, or cooking. And I recommend that you get into that practice at least every morning, flush your water system. Now, in all your fixtures, especially faucets, you have these aerators that make the water come out in a softer stream, and you can disconnect that. You must clean that out. Now, people don't worry, I'm giving all these instructions, but they are on the Genesee County Health Department website. They're on the City of Flint website. If you get filters or if you get a lead service line replacement, you will be given these instructions, and they're well illustrated and in print that someone my age can read. So don't feel like you're on your own. Uh, this information is widely available. So whenever you get a filter kit, you will get instructions. And if you don't, check your bag and ask for them. So flushing is important to reduce your exposure to lead.
Thank you so much, Dr. Reynolds. We can't re-emphasize all of these things enough. We know we're in the midst of COVID, but the ongoing issue with water is critical, because no matter what the health conditions are, if we don't have access to safe, affordable drinking water and water that we can use for any purpose, it always adds to the other challenges that we have. So thank you, Dr.
Before
Reynolds.
we go, I must
Yes.
add, dealing with your hot water system is a whole nother issue. Your hot water heater does need to be drained. And so I'm not capable of doing that kind of service. So you may want to get a plumber or someone who is experienced in doing that.
Thank you, Dr. Reynolds. And so this webinar will bring a lot of information to you, of course. There is access to other resources and information. So following the webinar, please look further into these so that you can address the information that's relevant to you and your family in an informed way. To further inform us about the testing, we are and all of the related issues about what's going on with COVID. Susan Cooper, who is with the Genesee County Health Department, has been with us every week, and she is with us and diligent. We communicate several times throughout the week to make sure that this information is the most up to date. So Susan, can you give us, Suzanne, please forgive me, Suzanne, can you please give us the update from the health department today?
Yes, so Yvonne, as of yesterday, again, reminding everyone that we post data to our website at 2 p.m. every day. So as of yesterday, we posted to our website the 2,393 positive COVID-19 test results and 264 deaths. And a reminder to everyone, because we had limited testing availability at the beginning of the pandemic, this is not reflective of all the cases of COVID-19 that have likely been in our community. I am not happy to report that we have had a 38% increase in the number of cases of COVID-19 in this last week. So that is concerning. And again, we want to emphasize the importance of communicating all of those prevention messages that we continue to share about wearing your mask, social distancing, washing our hands, using hand sanitizers, cleaning frequently touched surfaces. All of those messages are so critically important. So I encourage you to do those things and also to take care of your health. I will say that the percentage of hospitalizations has not increased with this increase in the number of positive test results. So what does that mean? That means that those individuals that are testing positive are not so ill that they require hospitalization. So that is something that is good news. As you heard from Dr. Reynolds, today we have another testing site that is functioning today and tomorrow from 9 to 1, and that is Word of Life. And they are doing testing with the Genesee County Health Department, the City of Flint, and the Michigan Department of Health and Human Services, and our National Guard. Again, there's no requirements for pre-registration. You don't need to bring insurance information. You don't have to have a doctor's note. You come and you get tested on site. We will have another testing site next week at Macedonia Baptist Church. Again, that will be from 9 a.m. to 1 p.m. Again, there's no doctor's note, no appointment, no insurance needed. We will continue to keep you updated. And we recognize the importance of having these testing locations available that make it easier for everyone in our community to access them without having to go through a website or make an appointment, get a doctor's note, or have any of those other pre-registration requirements that are a part of the other testing locations that we have in our community. I've been asked to answer a few questions, so I want to make sure that I can share some more relevant information. But I will say this, that we talked about the number of cases that we have posted to our website as of yesterday. I will say good news is, and it's not, again, thinking about this relatively, and not necessarily because we have only lost one person this week. One person's loss is more than we want, but we have had one death in this last week. So that's something to think about, and we really are encouraged that our mortality rate has not increased with this increase. But remember, between the time someone's tested, there's always the opportunity for a complication and a hospitalization. So this next 2-week period is going to be one we're going to be monitoring very carefully. But again, we want to make sure that everyone is taking those appropriate precautions. In this last week, between last Thursday and this past Thursday, we had 1,054 tests done. So we do have the testing sites that we've just talked about, again, today and tomorrow, that are at Word of Life today and tomorrow, and next week at Macedonia, plus all the other testing locations that are available in our community. And there are appointments available, so we encourage you to go and be tested. You've heard Dr. Reynolds say before, it's not one and done. I say the same thing. We're going to have to continue to be monitoring our own health and make sure that we test regularly. We do want to keep you up to date on some of the other concerns that we have. And so I've been asked about whether or not there's enough availability of testing materials. If you've been watching the news, you'll see that many other locations across the country are seeing significant increases. Their hospitalization rates have significantly gone up. There's tremendous strain on the hospital systems. They're seeing shortages of testing materials, and so there are a lot of challenges. We have heard from some of our providers that with a few of the labs that are doing testing, there is some limited availability of testing kits at the moment. So that is slowing the rate of testing in our community. But again, we are doing these testing sites at Word of Life and at Macedonia with the National Guard over the next 2 weeks. And we have plenty of test kits to accommodate anyone who comes for those 2 testing site events. So I want to make sure that you're aware of that. And yes, all of our testers are in PPE. We want to make sure everyone's protected. I'll remind you that there are 2 types of testing being done in our community. One is the nasal pharyngeal swab that goes a little bit further back in your nasal cavity. That is administered by a healthcare professional. That is what the National Guard does at the 2 testing sites that we'll have this week and next week. But our pharmacies are also offering testing, which is a nasal swab, and that's done in the presence of a pharmacist, but you physically would actually take the sample and provide the sample that is then shipped on to the lab. And the pharmacist is there to observe you to make sure that you're doing it correctly and that you have all the assistance that you need to move forward. We remind everyone again that Hamilton Community Health Network does their testing by appointment. And if you do not have a doctor's note from your own physician, they will make an appointment with you for telemedicine before you get tested when you go to the Hamilton site and you make that appointment. The same is true of Michigan Health Specialists. If you make an appointment for the Rite Aid or the Walmart locations, again, they are doing the nasal swab testing in the presence of a pharmacist. You actually collect the sample, and you do not have to have the doctor's note for those 2 events. So a quick reminder for Word of Life today and tomorrow, you just come and you get tested. For next week at Macedonia, you come and you can get tested. I also want to share with you that I remind everyone that early on in this pandemic, we had limited access to testing. And we were really limited with what we could do for testing in the community. So a reminder that on May the 1st, we had 4,143 tests conducted in Genesee County. That's about the time that some of the testing criteria loosened. And in the last 2 months, as of yesterday, we have done 18,406 tests in Genesee County. So we are seeing people going and getting tested. We encourage people to continue to do so. There's plenty of availability of testing. We know right now that some of our providers are seeing shortages in test kits. We hope that's just a short-term issue, but there's plenty of locations to be able to be tested. And I'm happy to answer any questions.
Thank you, Suzanne. And I do have a couple of quick questions for you. One question was, you talked about the increase to 38%. Is this, do you know if at all it's the uptick because of the 4th of July holiday or any particular instances that you might be able to share?
I can't at this time, but again, we have to do a little more analysis, but recognize that we have had 2 major holidays. We've had a number of protests in our community, and so that is not something that is out of the question. I did also want to remind Yvonne, too, a couple of things that I think are also important that people have asked about, and one is the length of time to get a test result. And I think this is important for people to understand that we're seeing a huge variation in the length of time for someone to get their test results back, depending upon where they were tested. Some locations, it can be 48 hours. Others, it's taking as long as 7 days. I will say to you that if you have not gotten a test result back after 7 days, it's not out of question to ask your provider if they provided the doctor's note for you to get tested. They should be notified about your result. You can connect with them. You can connect with the health department, but just recognize that there is a very significant variation and how long it's taking people to get their test results. The other thing I want to remind you, again, because it's taking that bit of time between the test results, that has a negative impact on our ability to contact trace and quickly reach out to someone who's been exposed, find out who they were in contact with when they were contagious. And so those are critical elements that we want to keep working on. We want to get tests done, and we want to get the test results back quickly so we can make those contacts to try to stop the spread of the disease. But if you haven't gotten your result in 7 days, that's when you should start making some inquiries.
Thank you, Suzanne. And you did answer one of the questions that came up in the queue about the length of time to get those test results. There is another question in the queue, and it's so interesting, Suzanne. You and I talked about this earlier. Dr. Reynolds has mentioned the importance of flu vaccines and other immunizations. And so I want to let our listeners know that next week we will be discussing this issue around immunizations. I think you heard it said that there needed to be some space. Sometimes it's a 30-day wait before you can get another vaccine. So this is a critical time to get caught up on those vaccines if you haven't. So we'll have some physicians on next week to talk specifically about that. So today we want to hear an update from Gary Jones from the state. He is with us every week again for the last few weeks, keeping us updated on what's happening out of the governor's office. So Gary, if you are unmuted, please give us your update for today.
All right, thanks, Yvonne. So total confirmed COVID-19 cases statewide, we're now at 71,842. Total COVID-19 related deaths are now at 6,101. And total of recovered COVID-19 cases as of July 10th are 53,807. And as a reminder, recovered is defined as the number of persons with the confirmed COVID-19 diagnosis who are alive 30 days post-onset. So I wanted to cover this briefly, actually, because Yvonne, we had talked about it in regard to the eviction diversion program. So just to give a brief, I guess, for a reminder, around the end of June, the governor has signed an executive order that created the eviction diversion program. It actually did two things. I will say it temporarily suspended evictions until July 15th, and then also created the eviction diversion program, which was outlined, it outlines the process for renters basically to get rental assistance or to establish a manageable payment plan. Rental assistance under the eviction diversion program became available July 16th, so as of yesterday. And I'll also post more information about this in the chat, or Yvonne, if you can do so. I think I sent you the website for the eviction diversion program.
Yes.
And locally, it's administered through Catholic Charities. There is a phone number too as well. The woman that you would want to talk to, the individual you want to talk to, her name is Tammy, and she can be reached at 810-232-9950 and extension 170.
Gary, would you repeat her name again for us? Would you repeat her name again for us? We had a little bit of a glitch in the technology here.
Yep, sorry about that. Yep, so her name is Tammy with Catholic Charities, and Tammy, she can be reached. She can be reached at 810-232-9950.
Thank you.
And extension 170. So a couple updates here. So the governor recently signed an executive order that allowed for remote education and supervision for pharmacists. So this is an extension of a provision of her earlier COVID-19 emergency order on pharmacies that allow student pharmacists to continue training under remote supervision. The governor also extended the declaration of emergency amid rising COVID-19 cases. So after every region in Michigan saw an uptick in new COVID-19 cases over the past 3 weeks, the governor took swift action by signing a new executive order. This executive order extends the governor's emergency and disaster declaration until August 11th. The governor also signed an order that scaled back suspension scope of practice for medical professionals. So this scales back the suspension of scope of practice law for frontline healthcare workers while continuing suspension of certain licensing and certification requirements for healthcare professionals, life support and first aid workers, and 911 operators. The governor also signed an order that extended protections for nursing home residents and maintained special hours of operations at grocery stores for vulnerable Michiganders. So through 2 executive orders, this extended the COVID-19 adaptation and long-term care facility to protect residents and staff, and extending existing safety measures, including 2 hours a week of reserved shopping time for vulnerable populations in order to protect consumers and employees at grocery stores and pharmacies. And both of the governor's orders were extended through August. The governor also took swift action to save lives and signed an executive order requiring mask use in all indoor public spaces. So again, this is, as a result of the uptick in COVID-19 cases that we have been seeing statewide over the past 3 weeks. Governor signed an order which reiterates that individuals are required to wear a face covering whenever they are in an indoor public space. It also requires the use of face coverings in crowded outdoor spaces as well. Most significantly, the order requires any business that is open to the public to refuse entry or service to people who refuse to wear a face covering, with limited exceptions, of course. And this also follows suit via similar orders in states like Kansas, Maine, Nevada, Pennsylvania, and Washington that also have similar requirements as well. And just as a reminder, michigan.gov/coronavirus is still the best website to stay updated with everything.
Thank you, Gary. We appreciate that update. And again, we know it's a lot of information, but you can get on Gary's list and he'll make sure that you get it all. Dr. Deborah Forholden, in the last couple of minutes of our time today, we're going to just remind our listeners and our audience that you can go on our webinars at any time. Your voice is so important in helping us get this word out to the community. So please feel free, when you get the link to the webinar, send it out to others and help us get the word out. Dr. Deborah, can you give us updates? You've always been helpful in making sure we get those succinct points during the last part of our session. So Dr. Deborah Forholden.
Yeah, great. So thanks to all my colleagues for giving us the update on where we are in cases. As you can see, we're on the rise. So I think now more than ever, what people practice for personal protection and health and safety is going to be even more relevant than ever. And I'm going to reiterate it as my colleague Suzanne Kupel did: wash your hands, mask up, use your personal protective equipment. Please practice the physical and social distancing. Health.
Okay, it looks like we've lost Dr. Deborah. So just please follow these precautions as you're seeing them up on the screen. Stay healthy if you can. Get a little additional exercise, be in the sun, continue to practice those primary precautions that are so necessary. And as you're doing here on the webinar, stay abreast of the current information. We're doing our absolute best to bring this to you. And as we close for today, we want to remind you that you can always review the webinars every week. Once the webinars are over, we're recommending that you stay safe, that you join us, subscribe to the YouTube channel, Healthy Flint. Email us any questions that you have at info@healthyflint.org. And of course, you are helpful in helping us get the word out and knowing what our topics are of interest. For those of you that have opportunity, to complete the pop-up webinar following the close of this session today. And I certainly want to say to you again, help us get the word out. When you receive our flyer about the webinar, we encourage you to send it to your friends. This information is available to everybody that has access. And if they don't have access, we are certainly depending on you to help us share these important insights with them. I want to ask you again, our panelists, there are a few questions left in the queue. Please answer those questions for us before we close officially the webinar. But for those of you that are listening, thank you for your time and attention today. And we look forward to seeing you next week. Remember, we'll be talking about immunizations in the fall and other relevant information based upon your input. Again, thank you and be safe.